living with aspergillosis in your words. This is a project I've been hoping to write for probably 18 months. And I think I've made a significant progress. So we've actually published some of this on aspergillosis.org. So what it comes from is from you guys, the patient. We've heard a lot about the doctor side defining whether you've got an infection or an allergy, the drugs that will help or won't help, and so on. So from the clinical side, we've learned quite a lot. But this is about your side. This is about what it's like to have this diagnosis and to have the treatments that you've had. Some of you have told us what that's like in your talks, and I'm sure we'll hear more about that in the chat afterwards. So, is it important to understand what living with a chronic disease feels like? So obviously the answer is yes, absolutely. Understanding what it feels like to live with a chronic disease is crucial for empathy, support, better healthcare outcomes. And this is not just you understanding what it's like to live. This is the doctors understanding what it's like to live with these diseases, because that's a crucial point that we're talking about here. Chronic illnesses such as ABPA, CPA, asthma, diabetes, arthritis, or heart disease affect not just the body, but also a person's mental, emotional, and social well-being, which Marcella illustrated beautifully for us in her talk. It is an extraordinary, difficult thing to come to terms with, at least initially. Why it matters, if you can understand what impact this makes, it improves your emotional support and empathy. Many people with chronic diseases feel isolated. That's another word that's come up this morning and over lunchtime, because others don't understand their daily struggles. Right down to, I think it was Lisa that said, people say that we look okay. And you're looking well today is a frequent complaint that you may look it, but you certainly don't feel it. Fatigue, pain, or unpredictable symptoms can be hard for others to relate to, especially ongoing, never going away fatigue. Awareness helps. Family, friends, and employers provide better emotional and practical support. So that's quite an important point. If we actually understand the impact that these have on your life, then we can convince your employers that what steps they can take to help you work with your chronic disease. As all of you will know, symptoms can fluctuate. One day you may feel fine, the next you may struggle to even get out of bed. That's a common theme that I hear time and time again. Understanding prevents accusations of laziness or exaggeration. And that goes for your carer, your partner, your family, everybody. If they understand, then they will hopefully realize that you're not staying in bed for no reason, or you don't run out of energy at 2 o'clock in the afternoon for no reason. It's your chronic disease. Quite often somebody said they can't make plans a few days in advance because they just don't know how they're going to feel a few days in advance. And it helps with the person's that you've had to turn down, understanding of why you had to turn it down if we have this. It helps in the workplace and in social inclusion. People with chronic illnesses often face misunderstandings at work, leading to discrimination or lack of accommodation, and that can rapidly get out of hand, and people can be losing their jobs or being threatened with losing their jobs, which causes stress, which doesn't help the whole situation at all. Awareness allows employers to provide flexible working options, reduced workload, or rest breaks. And I think that's actually a legal requirement nowadays. When I say nowadays, has been for some time with the Disability Act, which came in at least in the UK and probably across Europe. Friends can adjust social plans, as we just talked about. Here's a good one. Many chronic disease sufferers feel dismissed by doctors or misunderstood. And that's easy to understand. You might be the 50th person for that doctor has seen today. And you're just complaining about something he can't do anything about, or she can't do anything about, like fatigue. And something they can't measure, which they hate, like fatigue. Understanding why you're fatigued and what's causing it. And in one of our talks before last year sometime, I mentioned some research that had been done which demonstrated that there is a fatigue switch in our bodies that is designed to be turned on if we get sick. And that's why if you get the flu, you just want to stay in bed. It's a mechanism in our bodies that tells us to rest. It's not you refusing to be active. If that switch is off, there's not much you can do about it. So it is, as we get greater understanding, it does help. If healthcare professionals, family and society better understand chronic illnesses, it leads to better diagnosis, more accurate diagnosis, less medical gaslighting. It's just anxiety. I'm sure everyone's heard that one time or another. And better treatment adherence, because if you understand why you're being treated in the way you're being treated, you're more likely to carry on to ensuring that you get that treatment. Mental health is obviously a very important part of this. Taking certain medications long term, including prednisone, can bring on anxiety, depression. And especially in the early days of being diagnosed, I think Mick talked about lost abilities quite a bit, and you grieve over those lost abilities. So it's important to understand that. Understanding it helps people acknowledge emotional struggles without shame, which is probably a taboo subject, but a very important subject. These are the things that we talk about every week on our support groups and try and help in some way. How can we understand better? Listen to people without making assumptions. Read patient stories or just watch the videos. Now Lisa's mentioned the videos that Aspergillosis Trust have. NAC also hosts a list of videos for the same reason. All of the videos that were being taken today will all go on to the NAC YouTube account for people to watch at their leisure. Acknowledge invisible symptoms like fatigue, brain fog or pain. Make them not personal, make them part of the illness, something that people can't do anything about. It's part of you being ill. It's not you saying, I'm not going to get up this morning, or I'm going to run out of energy. I can't think properly in my job. Learn about the emotional burdens, not just the physical symptoms. So, having listened to many, many stories over the hundreds and hundreds of them, I thought it would be useful about 2 years ago to do a poll in our Facebook group, which has just reached 3,000 people, I think. Everybody, ABPA and CPA and everybody else, it's an Aspergillosis group. We're all in the same group, which is great because we get lots of people and get lots of energy in the group. But and not so good in that we have to make sure somebody understands that we're talking about the right type of aspergillosis, because as Chris said earlier, there are completely different types which require completely different diagnosis and completely different treatment. We just asked the ABPA group, what aspect of your current quality of life are you most concerned about and would like to improve? The ABPA group, there were 104 voters in the ABPA group, and if you, I think I wrote down a few of these, but the rest of these were added by patients saying, I'm worried about this, I'm worried about that, things like, I'm worried about being dependent on medication, I'm worried about pain, and so on. And it's quite easy to see the number one thing that people are concerned about is fatigue, which is what we've talked about this already. Then there's breathlessness, and then there's coughing. There's a clear top three: fatigue, breathlessness, and those are the main things that people are worried about with ABPA. There's a whole list of other things also, some of which you'd expect, some of which not so much. If you're on ABPA, hair loss is kind of unexpected to be so high up. The threat of catching a virus that causes a flare is another one. Then nausea is obviously a common one, but I didn't really associate it with ABPA. We also did the same thing with CPA, and the slightly different fatigue is again the number one. So it's obviously important in both infection and allergy and inflammation. But now breathlessness and poor fitness was the third option. And again, the top three are quite separate from the list of other issues. So what to do with this information is clear. Patients are clearly trying to tell us something about being ill with these illnesses. What can we do? And what I thought I would do all the way back then is address specifically a few of these headings. If we go way back, if we go way back to before Aspergillosis Trust, there was another charity run by patients about 2010-ish. And they designed a whole set of leaflets. I think it was about a dozen that were designed to be given to new patients and a variety of other people. And we've rewritten those recently. We've rewritten the whole subject. And so what I wanted to do was update and rewrite the whole lot, take a different view, but use the same information that was contained in those leaflets to inform people about all of these subjects. So that's what we've done, what I've done. Essentially what I've called it in their words, CPA and ABPA. And to get here, you go to aspergillosis.org, and if you click on, I think it's information and support, you'll get in their words CPA and ABPA popping up. There's a disclaimer because obviously some people who access this information may think that this is medical information. This is an NHS supported website, and it's not. This is information from patients and some hints and tips from us as well. So this is a disclaimer to say this is not medical advice. Read it, enjoy it, but don't change your life around it. These are just hints and tips. If you take on one or two, you might improve your life 1% or 2%. If you take on 10, you might improve your life 10 or 20%. Who knows? We don't know. But they're all things that patients have mentioned that they feel have done them some good. You click on chronic pulmonary aspergillosis or ABPA, and it will take you to. There's the list about. Which I just mentioned in their words. That's the link. If you click on there, you get to the first one that was for both of them was fatigue. So I've clicked on fatigue, and this is the range of information that is now listed under fatigue. Things, different ways that your fellow patients and some of our other hints and tips suggest that you manage fatigue. So medical management, optimize your treatment is one thing. Energy conservation, so prioritize your activities. You're only going to have so much energy in one day. Make sure you spend it on the things that are most important to you. Alternate periods of activity with rest. Improve sleep quality. Seems obvious, but that's quite difficult to do, especially if you're some people respond to taking steroids in certain ways that can keep you awake. So you focus on establishing a sleep routine, get yourself in a restful environment, keep the bedroom cool, dark and quiet, elevate the head of the bed. I find this often talked about by people who have ABPA because they're coughing a lot, and they're elevating the head of the bed helps cough. Might be worth visiting your GP to address sleeplessness. There might be something else in there like sleep apnea that needs attention that would help. Physical activity and exercise. something a lot of you wouldn't contemplate doing, but can be a terrific improvement in your quality of life if you take on some form of gentle, regular exercise. Certainly not pushing yourself in any way. Getting out for some fresh air every day can really boost your emotional health as well as your physical health. And how much else have I put in here? That was it. There are a list of maybe 20 more pages like this. This goes on for some time as well. So there's a lot of information in there. It's meant as a sort of a reference. If you're looking for hints and tips as to how you might improve your day a little bit, have a look at there. Almost everything's listed on there that people have mentioned. People with ABPA and people with CPA. It's split up according to ABPA and CPA. I think I will attempt to do another one on Aspergillosis bronchitis because that's a separate infection that a lot of people have, and we don't see a lot of information about that. So I'll do one for them as well. And that's it. I hope it's a useful source of information going forward. This is just telling you it's called In Their Words, CPA and ABPA, and you can find it on the aspergillosis.org website. And I hope you find it useful.